Welcome and thanks for joining us on the Flourishing Life podcast, where we will be discussing what we see on the daily. We're Jackie and Tab from Flourish Medical and Wellness in Savage, Minnesota, where listening to our patients is the priority. Our foundational medicine clinic bridges the gap between traditional and functional medicine. We are pattern recognition specialists that focus on individualized patient care and health optimization. With a combined 30 years of medical experience, our goal is to provide insights that will help you take control of your health. Be sure to follow us on Instagram at Flourish Medical Wellness and on our website, flourishmedicalwellness.com, to stay up to date with what's happening at the clinic. The following content is the opinion of Jackie and Tab Tewes and is not intended to diagnose or treat any medical conditions. Please be sure to speak to your healthcare provider for your unique needs. Welcome back, everyone, to the Flourishing Life podcast. I am super excited to have our very own Patrice with us today. She is who I call our metabolic specialist, and so she is going to let us inside of her brain for this episode, which I think is super helpful coming into the holidays. So she is really great with helping patients walk through kind of the weight loss and metabolic, all metabolic health. So I would love to just kind of tell us about your background, who you are, where you came from, and just help the viewers kind of get to know you a little bit.
Yeah. So I am married. I have 3 kids, 3 little girls, so they keep me very busy. We have a dog as well. We live in Mendota Heights. I was born and raised there. So that's just a little bit about my personal self. As far as my medical background, I went to school at St. Kate's for nursing. And then I worked as a nurse at United for about 4 years. Went back to NP school at St. Kate's again. Finished that up. And then I worked in geriatrics for about 10 years. And, found that was a lot of just kind of providing sick care instead of health care.
Yeah.
So took a chance and started working with you guys a couple of years ago.
Love it. So today we are going to talk about all things metabolic health. When did that interest kind of start in you, or have you always just kind of had that type of interest? Tell us a little bit about that.
Yeah. So I always grew up playing sports, was always an athlete, and I actually had pretty bad asthma as a kid. So I wanted to improve my lung health. So I started running in high school, and my lungs got a lot stronger and my asthma symptoms went away. And that drove me into being interested in nutrition. So I started kind of reading up on that, trying different things. And then after college, I got into CrossFit. And that's when I really learned how to fuel myself appropriately for athletic performance and got into strength training. Unfortunately, I had to step away from that type of training because it led to some adrenal fatigue for me, poor sleep, chronic injuries, etc. But I learned a bunch from doing that type of training.
How did you notice that? How did you figure out, okay, I need to stop. This is not good for my body any longer?
Yeah, it became very apparent postpartum. I kept herniating my disc in my low back over and over again. Couldn't take care of my kids, essentially. And then I would be up, I wouldn't be able to fall asleep at night. And then I'd wake up in the middle of the night, just kind of panicked. And then I just started to gain weight. I carried about 25 pounds extra. And it took a long time to get rid of that weight. But as I slowly dialed the high intensity off, the inflammation went down and the weight just slowly came off. My sleep started to get better. My mood was better. I wasn't dealing with chronic pain all the time. Yeah.
Did you have an aha moment, or was it just, did someone talk to you about hey, I think you need to maybe not do this?
I had an aha moment where I was like, it's not normal to be in pain like this. Yeah. I shouldn't be waking up from a workout not being able to walk.
Yeah. And was it hard to
oh yeah,
make that transition?
Yeah. I was obsessed, and CrossFit is a community. You have a lot of friends there. You look forward to going to the gym. So that piece was really hard to give up. Yeah. But I just knew I couldn't go on like that anymore.
Yeah. Was Peter, was your husband in CrossFit with you?
Yeah. Okay. And he kind of started to notice the same things. He wasn't gaining muscle. He kept getting injured as well. His sleep was never affected, but he wasn't feeling good, really achy. And then he also when he would come up, we have a gym in our basement, when he would come upstairs from working out, he'd be really irritable with the kids instead of being more calm like you should be after a workout. Yeah.
Super interesting. Okay, so you see a lot of our metabolic health patients, weight loss, all the things. So what are some common pitfalls that you see like pretty routinely with patients when they come in?
Yeah, it can be all over the spectrum. Like some people have really good knowledge on nutrition and exercise, some people don't. Big things I see is people starting off the day with a lot of sugar. They'll have a sugary coffee, totally skip breakfast, just have their sugary coffee, go to work, and then they're on this blood sugar roller coaster all day long. They can't figure out why they're always needing a snack and why they're always having to grab things and munch on things. Well, it's because your blood sugar is low and you're trying to get it back up to feel better. So that's a big one. Not preparing food. A lot of people want to lose weight, but they don't want to prepare food. And it's just not doable. If you're not prepared, you're not going to lose weight. So that's a big one. Not scheduling in workouts. So they'll say, yep, I'll fit that in, but then they don't schedule it in their planner. So you really have to be disciplined to have that scheduled in your planner so you're more likely to do it. I also think a lot of people rely on motivation, and motivation doesn't last very long. So you need to rely on discipline. You have to be disciplined, and it can be really hard some days, but you just have to be like, okay, I have to do this and get it done.
That's a really good point. Mm-hmm. I've never thought of it in that way. Yeah. Discipline versus motivation, because you're 100% right. There are so many days where I'm like, oh, I do not want to do this. Yeah. But it's just not. It's a non-negotiable. Yeah. Right? It's just, this is what I do. Yep. So that's a really good point.
Also, I think people snack too often. Instead of really focusing on, okay, I have set meal times. That's where the discipline piece comes in. They just find themselves hungry, so then they grab a snack, and you're just, again, on this constant blood sugar roller coaster all day long.
Okay, let's take a detour here. This was not on our question list, but what are your thoughts? So there was this time period where all of the kind of nutrition, health, workout gurus were telling people to eat every 2 hours. Mm-hmm. What are your thoughts on that?
Yeah. So I probably have a lot different thoughts.
I know. So I'd be curious.
So I personally, that's kind of how I eat. And that can be very patient dependent, right? So me personally, I work out about an hour a day. I walk my dog. I have 3 little kids I have to run after. I work. I'm also breastfeeding. Like, I have a lot of energy demands, right? So I find that smaller frequent meals throughout the day keep me energized. Whereas I've tried doing like 2 to 3 bigger meals a day, and I don't feel good. I feel full. I feel sluggish. I get bloated. It's just not comfortable for me. And then I feel like I digest it really quickly, and then I'm hungry again, right? So that type of eating does not work well for me. And I also find that I'm able to keep my calorie intake and my portions under control, because I know, okay, I'm going to eat this meal and then I'll have another meal in 3 hours. It's okay that I don't feel overly full. Mm-hmm. And I think it's important for people to understand that feeling where you don't need to feel overly full. We don't need to feel stuffed after a meal.
You're not supposed to.
No.
Right. Have you ever done I'm just curious, have you ever done a CGM with like checking how you're eating?
I have not. I have one in my drawer, but at home. But
I would love to know, because that's the like question I have, right? Because usually it's about 4 hours for insulin to do its thing, and then your sugars to kind of get back down. Yeah. So when you do it, let me know. I'm just curious at like where your blood sugar is hanging out. But so much of that, there's 2 things, I think. Number one, what you're eating. So you can't just eat every 2 hours and not plan and prepare, like you mentioned, because for sure if you're eating fats and proteins, like your blood sugar should stay pretty stable. Yep. But the majority of people aren't doing that.
Exactly.
So that's where it can be really tricky.
Yeah, so you have to do it right. You have to make sure you have all 3 macronutrients at that meal. It needs to be a meal. It shouldn't be a snack. You shouldn't be snacking 5 times a day. It should be a meal with all 3 macronutrients. You should be sitting down, eating it, letting your brain figure out, okay, I'm full, than just sitting in front of your computer eating kind of a snack, right?
Like crackers and cheese.
Yes. And then also, it's important to have those set meal times. Like, have your eating window, have your set meal times, because then you're giving your body a chance for that blood sugar to spike post-meal, which happens, and then it goes back down to normal, and then you just let your blood sugar stabilize. So that's so important.
The other thing too, I don't know how much you've done of this, but kind of the genetic test I find to be super interesting because it tells us in there, and it almost always lines up with what my patients feel.
Yeah.
Like they're not a good intermittent faster or like the pattern of eating. So genetically, I think there's some components as well, depending on that DNA blueprint of, are you someone who needs to eat every couple hours as long as it's the right things? Or are you better with some of those longer windows? So
yeah, for sure. It's definitely depends on the patient, and I'm always happy to help kind of figure that out with patients. It's not a one size fits all.
For sure. Nothing is.
No.
Nothing. Okay, awesome. So let's talk a little bit about kind of insulin resistance. What is that? How do you approach that with patients?
Mm-hmm.
And are there things, I get this question a lot. Okay, so I'm prediabetes. Can I change this? Like, are there things we can do about it?
Mm-hmm. Yeah. So basically, insulin resistance is when your body's cells become less responsive to insulin, which is a hormone that we make. So this can lead to high blood sugars, difficulty losing weight. It also can increase your appetite and can increase cravings. And then oftentimes those calories are stored as fat, which obviously we don't want, right?
Because they're not being used for energy.
Correct. Yeah. So some cool things that we do at Flourish is we test fasting insulin, which is the earliest indicator that a patient has some insulin resistance going on. Because oftentimes in modern medicine, just a fasting glucose will be checked or a hemoglobin A1C, and they'll say, oh, you're fine. But really, deeper down, there might be some insulin resistance going on. So that's an important thing I think we do at Flourish. And then as far as what we can do, I think having a set eating window, having your set meal times, like we kind of talked about, making sure your plate is balanced with all three macronutrients so you don't have these crazy blood sugar spikes. Mm-hmm. You want to make sure we're not just eating carbs, like just grabbing a banana or some crackers or chips or things like that, because that's causing your blood sugar to spike, and there's nothing to help balance it back out. Some of my favorite things that we can do is using a GLP-1. That can be super helpful with insulin resistance. Like a microdosing approach can be really effective. Weight loss is super important. Simply walking after every meal or just doing some sort of physical activity. So just go for a 5 to 10 minute walk post-meal. That'll help bring your blood sugar back down. Cool. Strength training. Yeah. So that's super important. So your muscle uptakes glucose. So you want to make sure you have adequate muscle. People with insulin resistance definitely should be doing some strength training.
As their muscle mass declines, now there's nowhere for that sugar to go.
Yes.
And so now we're just walking around basically with higher sugar in our blood.
Exactly.
Because we don't have enough muscle mass to support that.
Yep.
And I think that's pretty common. I often hear this from women about, well, I'm not doing anything different, but I'm gaining weight. Or, well, that's because your body's changing.
Yeah.
As we get older, we can't do the same things that we used to do. And a lot of that stems back to because our bodies are changing, our hormones are changing, our muscle mass is changing. Yep. And so we do have to change with it to have the same results, the same outcome.
Yep.
Okay. So you have talked a couple times now about macronutrients. I love that you talked about carbs, and the first thing you said was a banana, which is great. But I think most people are like carbs, pizza, carbs, bread, right? So talk to us a little, what are macronutrients? Why do they matter? How do you recommend patients fit that into their plan when it comes to either weight loss or just weight management as we age?
Yeah. So lots of big things here. So macronutrients there's three main macronutrients. The first one being protein, second one being fat, and the third one being carbs. I think a lot of patients have a misunderstanding about carbs. They say, I need to lower my carb intake. And then when I ask them what that means, they're like, well, I'm eating too many donuts, cookies, blah, 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 blah. Yeah. Well, really, your fat intake is too high, right? That's not the carbs' fault. Another important thing with those three macronutrients. So proteins, 1 gram of protein equals 4 calories. 1 gram of fat equals 9 calories. And then 1 gram of carbs equals 4 calories as well. I think macro counting is really important because it teaches patients proper portions. And then it keeps your plate really balanced. So after you eat that meal, you should feel full and satisfied. There should also be some fiber on that plate, so you aren't finding yourself hungry quickly after eating. I also think it's a good approach because it gives patients some leeway of maybe having some of those treats mixed in their diet. And it's also just a healthier mindset instead of calorie counting, in my opinion. It's also really important to figure out your maintenance macros. So the maintenance macros are the number of macros or calories, essentially, you can eat a day without gaining or losing weight. So we want to figure that out, especially when we're approaching weight loss or even if you're wanting to build muscle. So we want to figure out where those maintenance calories are for that patient. And that can take some time. It can take a few weeks to figure that out. Once we have that figured out, then if you want to cut weight, then we can put you in a slight calorie deficit in a healthy way. Mm-hmm. Or if you want to gain muscle, then we can put you in a calorie surplus in a healthy way. So it's really important to have that figured out for each patient to help guide our approach.
So when you say in a healthy way, we're adding in probably proteins, increasing our calories, and then in a deficit, what are those kind of calories that you typically reduce or take away?
So it kind of depends, again, on the patient, and it also depends on activity level. So someone like myself who's very active, the fats are likely going to be cut down quicker than the carbs because I need those carbs as an energy source. Again, you have to be careful though. You can't get fats too low. So generally the fats, you slowly start to cut down the fats and then you hit bottom. You can't cut them down anymore because then there's going to be issues with hormonal health. Then you can start cutting down the carbs. But we never want to cut down the protein. You always want to keep protein the same. And then a calorie surplus, if you want to gain muscle, generally it's increasing protein and then increasing the carbs because the protein and the carbs are fueling your muscle in order to put on muscle mass.
Well, do you ever use a calorie count on the in-body? Like, do you find those correlated out?
I mean, that's based off of skeletal muscle mass, right? Which is important to know. But it doesn't account for expenditure for the day. Right. So I think it gives us a good starting point. But for a lot of people, that can be really low, like 1,200 calories. And I don't want to, especially women, I don't want to see women just eating 1,200 calories. I want them to feel empowered that they can eat, fuel themselves properly, and have energy to do strength training. Mm-hmm. Yeah.
Well, how long did it take you to feel comfortable with macros? Because I'm assuming now you personally are at a point where you kind of just eyeball and kind of know where things are at.
Yeah.
Realistically, how long does that take someone to kind of get that comfort level?
I would say it took me probably a year or two to really understand it. And again, though, if I'm cutting and I want to cut weight, you have to be spot on. You have to be weighing things. You can't be eyeballing. If I'm in more of a maintenance calorie phase, then I'll eyeball. Okay. And even with trying to put on muscle too, you want to be measuring that out. So if you have specific body composition goals, it's really important to be measuring those out.
Sure. What about those people who would just don't want to be overweight? Do you recommend that they really count too? Or is it more like, hey, spend some time figuring this out and then, because I find most people have no idea. They think they do, but then when they actually sit down and do a food diary or they're really actually tracking, it's way off from what they thought.
Yes. I find that a lot when people bring in their food diaries. They say, I'm hardly eating anything. And then I'll look and I'm like, For those people, they don't have a whole lot of knowledge in nutrition and macros and all the things. Just starting out tracking protein is a good place to go. Just give them their protein goal for the day. Have them just track that. And then generally a lot of those bad habits kind of fall to the wayside because they're full.
They're more full.
Yeah.
All right. Meal timing.
Yes.
I'm interested to hear what you have to say on this one too. So that's the cool thing I think about the different providers here is that we all kind of have our different niches and our specialties, and we really put a lot into that. And so it's okay. Like, we might all have a little perspective. And sometimes I have patients where I'm like, I'm really struggling with dairy. I want you to go see Patrice because maybe we need a little different angle than what I am usually doing or seeing. So how do you recommend meal timing with regard to metabolic health and then weight management, and then also carb timing?
Yeah. So meal timing, first off, pick your eating window. So that could be 7 a.m. to 7 p.m., for example. Then pick your consistent meal times. So let's say you're eating 3 meals a day. Maybe breakfast is at 7 a.m., lunch is at 1, and dinner's at 6. And again, the number of meals per day can vary greatly patient to patient. So men tend to do really well with intermittent fasting and skipping breakfast. So for a male, they might find 2 meals a day is appropriate. Women, we tend to struggle with skipping breakfast a little bit more. We're more wired to want to eat in the morning and bring those cortisol levels back down. So women, I feel, tend to do better with eating earlier in the day and then slowly tapering that off towards the end of the day if they want kind of a fast period in there. And then, so secondly, pick how many meals you're going to have a day. And again, that can vary greatly patient to patient. So someone who's very active or doesn't feel good after eating big meals might need to eat more frequently, small, frequent meals throughout the day. Or versus someone who is more sedentary, that has an office job, not moving around a lot, they likely only need like 2 to 3 meals a day. So picking that out. And then you want to make sure with each meal, you have all 3 of those macronutrients like we talked about. As far as when to eat carbs. So carbs are best consumed pre and post workout. So pre-workout, we want to make sure you're having the protein, a little bit of fat, not a ton, and some carbs. And then post-workout, you want to make sure you have this about the same amount of protein as you had pre-workout, a little bit of fat again, and then a lot more carbs. And as you get further away from your workout, you want those carbs to decrease throughout the day. The reason for that is, like I said, your muscle is most sensitive to insulin at that time post-workout, so it'll be able to uptake the glucose from the carb.
When you talk carbs, what kind of carbs are you referring to?
Yes, so carbs should be from whole foods. So it should be sweet potatoes, oatmeal, fruit, vegetables, rice, those types of carbs. It should not be donuts, cereal. I don't love for a few reasons. Things like that.
Just wanted to make sure that was clear.
Yeah.
That can get a little muddy. I think people think different things of carbs.
And I also think it's important to note that carb intake can vary greatly. So, for example, a sedentary woman might only need like 50 grams of carbs a day, whereas a high-performing athlete who's a woman might need up to 400 grams of carbs per day. Yeah.
That's a lot.
Yeah.
Okay.
Yeah.
Good to know. On that note, I know this is a really probably a bad question, but if we're generalizing for the average woman, say 40-year-old, average height, average weight, I would say the average activity level in the United States is pretty low.
Yeah.
What would you say kind of a ballpark ratios are for those macros? Like, just ballpark it.
Yeah. So first of all, you want to pick how many grams of protein you're eating. So for a woman or a man, you pick 1 gram of protein per pound of ideal body weight. So let's say this woman weighs 150 pounds. Her ideal body weight is 130. Well, her protein goal for the day is 130. Then you want to pick how many carbs you're going to eat per day. And that'll vary based on activity level. And it can even vary based on, is she active? The day she's active, her carb intake might be higher than the day she's not active, right? So if that person, let's say she spends 30 to 45 minutes doing some strength training and then is sitting the rest of the day, I would probably keep her carbs around 100 to 150 range. And then you fill in the remaining calories with fat. So you calculate how many extra, let's say this person needs to eat 1,800 calories. and you add up her other macronutrients and she's only at 1,500, let's say, then we need to figure out, okay, how many grams of fat she needs. So you take that number of fat, let's say it's 60 grams times 9 to give you that amount of calories. And then the important piece with hormonal health is that that fat doesn't get too low. So for a woman, you want at least 50 grams of fat a day.
I know you talked about a little bit about timing of eating.
Yeah.
Do you recommend that people eat their actual food in a certain order when they're sitting down to eat?
Yeah. I think if weight loss is your goal, eating the protein first, because that fills you up. And then you might find, okay, I don't need all the rest of this food on my plate. But generally, I like to see people like having an appetite too and wanting to eat all of those nutrients.
Exercise. I think we're currently living in a protein and weightlifting world, right? Like that's what you hear and see everywhere. So kind of tell me a little bit your opinion on exercise and strength training, and then just other types of exercise that we might not hear a lot about. Like, how do you approach that with patients, the whole exercise piece?
Yeah. So I get a lot of patients who want to lose weight, but they don't want to strength train. So yes, strength training is key. The reason for this is that our metabolic tissue is from muscle. So we have an obesity epidemic in the United States, but really what we have is an under-muscled epidemic in the United States. We're much more sedentary than like our grandparents. We don't have to do as much manual labor. We don't even have to go to the store to get food. We can just have it shipped to our house. So it's really important that we're preserving as much muscle as possible. And that actually gives people more food freedom. I don't know how many women come in and say, I'm hardly eating anything at all and I can't lose weight. They're eating 1,200 calories. They're still not losing weight. And I'm like, you need to do some strength training. And for those people, a reverse diet might need to be done. So many women want to lose the weight right away, but if you do that and you keep breaking down your muscle and you keep getting in these extreme calorie deficits, you're just setting yourself up for failure. Yeah.
So strength training is important.
Yes.
What other types of exercise do you recommend?
I like women to take up space in the weight room. I don't think there should be like a huge separation in the strength training aspect for women. I think women can be deadlifting, back squatting, doing all those things just like men.
Do you recommend heavy lifting? Do you recommend lifting to failure? What do you like?
Yeah, I think it depends on your goal at the moment. So if you're in a calorie surplus, you're trying to build muscle, then those reps might be lower and you're going to be lifting more to failure. I think from a health standpoint, that can lead to more injury. So we have to be careful. So just trying to be cognizant of, okay, is this weight challenging? Keeping the rep range between 8 to 10 reps can be a good go-to. And then making sure you're progressing. So I see this time and time again that women are picking up the same weight for the same exercise over and over again, and they're not changing up the reps or anything about it, and they can't figure out why they're not getting stronger or losing weight. Well, you need to change up either the reps or the weight so you're progressing forward and building muscle. And that's the same for men too.
Sure.
And then as far as other important activities for weight loss, being in more of a steady state cardio, something like walking with a weight vest, incline walking, stair stepper, those types of things can really help with fat burning. Also, high intensity training can be super helpful with fat burning and building muscle, but you want to be smart about it. We don't want to be doing it for like an hour long. So something like 30 to 60 seconds full out sprints, resting in between, do that for 5 rounds. That's literally it. You don't need to do any more. And you can do that 3 times a week. That actually helps build muscle and reduce fat.
Well, it's pretty crazy. Do you have a generalized statement for the number of times women should lift and then do some sort of cardio with that in a week?
Yeah.
Is it the same for men, or would you give other recommendations for men?
I think first I always like to start off with, what are you realistically going to do every week for the rest of your life? So if someone hates it, maybe that's only 1 time a week.
Sure.
But that's still better than nothing. Blanket, I would love to see men and women doing 3 full body strength training sessions a week. And then they could do some HIIT training after that and then do more of the steady state cardio on the other days. That would be a great plan.
Well, have you seen people overtraining? And what does that look like? I mean, you kind of talked about that with your personal experience with CrossFit, but do you see that with other patients as well?
Yeah, especially in the women population, for sure. I think a lot of women have this sense that, okay, I need to burn calories, which simply is just not a good approach to weight loss. So women are the ones who are often running 5 miles a day, running marathons, doing boot camps, HIIT training for an hour, etc. And they're just spinning their wheels and they cannot figure out why they're not losing weight. Well, your adrenals are probably pretty fatigued at that point, and your body's spitting out cortisol, which is a stress hormone, and your body's just hanging onto that fat because it's too stressed to lose weight. And the other thing with that type of training, it's not building muscle, it's actually breaking down muscle. So you're breaking down your metabolic tissue, and no wonder you're not losing weight because your metabolism is actually slowing down. And like we talked about, I've been in that position before, and it takes a long time to get out of it. But once you get out of it and slow the training down, you'll be shocked that the weight will come off.
Would you say you felt better first and then like the weight eventually changed?
Yeah.
Like, you could tell like, okay, my body just is feeling better and not as sore and sleepy. Okay, I don't know if you hear this. I hear this a lot from patients. They're afraid to stop what they're doing, or they like running is my outlet. Like running or these specific high intensity classes are their mental health outlet.
Mm-hmm.
What do you tell those people?
I think to start, I say you can still do that. Just cut it down a little bit. So maybe just do 1 run a week and one high intensity training a week, and then swap it out for the strength training.
Yeah.
I do also think too, from the endorphin standpoint, if they do some quick HIIT for 5-10 minutes post strength training, they'll kind of get that endorphin hit.
Yeah.
That's where I kind of try to start with those people. It can be really hard to get through to those people.
It is. It's tough. And their body's so dependent on that. And it's a healthy outlet to an extent, but then it becomes
not a healthy
unhealthy.
Yes.
And then there's a lot of undoing, which is not quick.
Yeah.
Usually. So give us kind of an overview to just your general approach to weight loss when a patient comes in to chat with you.
Yeah, so we do like a 75-minute weight loss consult. We do lab work, in-body scan, all of those things. And so first I assess the patient where they're at. So we talk about, okay, how much weight would they like to lose? For some people, it's more of, I want to get my body fat percentage in a healthier point, or I want to get my visceral fat down, or I want to put on muscle. So it can vary. And then secondly, I like to go through their diet with them. Having a food log, bringing a food log in when you eat with me can be really helpful. So we go through all that. Also talking about liquid calories, like are they drinking alcohol every night? Are they having sugary lattes? Where are those other calories coming from? So getting the specifics on that. Then talking about stress levels, sleep, and barriers, like if they have an injury and they can't do weightlifting, etc. So assessing where the patient is at. And then I like to do a habit stacking approach. So typically, for most people, it's just starting with hitting a protein goal per day, because a lot of times, like I mentioned, all those bad habits will just kind of fall to the wayside because they don't have room to eat their bag of chips or whatever it is. So we'll do a habit stacking approach with them, and then setting up activity goals. So maybe for that individual, it's just 1 strength training session per week, and that's where we start. And then the other days, they're going to try to walk more. So just keeping it really simple. And then as they get more fit and feeling better, we just add other things in.
Love it. I love that habit stacking. That's really, I think, helpful, and just a catchy way to remember that too.
Yeah.
Like, let's do one thing at a time. There's so much information we can give you, but it's not always good to just...
Yeah, I think people get really overwhelmed, and then they try to go all out, and then they just fall off the bandwagon.
For sure. Have you had any experiences with patients coming in on peptides, on some GLPs, with very little or no management of that. And what have you seen there?
Yes, I've had that happen a few times. Patients get overly excited, so they go and buy the peptide online, and they're coming to see me to help manage the other stuff. So I've seen where patients are started off, first of all, on the loading dose, which is often too high to begin with, and then they're quickly tapered up to the full dose. Mm-hmm. Most people should never be on the full dose. There's a few people who need that amount, but most people should not be. And then they're feeling sick to their stomach. They have no appetite. They can't get any protein in. And they're just in a very bad state. If you are going to go the peptide route, which I think they're great tools, make sure someone is monitoring it. You should also be having some sort of scan done, like an in-body scan, because weight is only one piece of the puzzle. It's not looking at, okay, are you losing muscle? Because we don't want you to be losing a ton of muscle. And then it's also not showing if you're losing body fat, etc. So it's really important to be monitored appropriately.
Yeah. Do you, again, this is kind of off topic, but with the GLPs, I still have some patients that are hesitant or think, they've kind of heard all the scare tactics out there. What do you hear the most commonly? Like, oh, they're bad because ... And then what would you say to that? Like, what have you found in your research, in your practice, what you're seeing with people with these peptides?
Yeah. I think to start, the dose makes the poison. So I think people need to understand that. So yes, you can see bad side effects if you're on a super high dose. Pretty much anything. Yeah. A lot of people are afraid about the gastroparesis and their GI tract slowing down. And again, I try to reassure them, yes, that can happen, but generally that happens when we're on a super high dose. And that's just not our approach at Flourish. We like to do more of a microdosing approach. I'll have people bring up the studies about people going blind, which was not a good study. Basically, they studied a population of diabetics who are already at risk of going blind and found that some of them went blind when they're on the peptide. So this is
like we literally make our diabetics get like eye checks every 6 months because we know that they're at risk for retinopathy.
Yeah. So
because of the sugar, not because of the GO.
Yes. So yes, just kind of walking through those things with patients and breaking down the research and explaining to them why that might not have been a good study. Yeah. And then lots of new studies are coming out showing like it's lowering cancer risk, lowering cardiovascular risk, like all these great, amazing things.
Yeah. And I think your body always tells you if it's being done the right way. You can see that skinny fat when it's not being done the right way. You can literally see it on the person, just like you can see if they're not at a healthy weight and if they're not healthy, if they're overweight and unhealthy, or if they're underweight and unhealthy. And so it's your body tells us. If you have a person, they're on a GLP and they look healthy, it's healthy, right? And they're doing it's doing good things for you. If this peptide was really such a terrible thing that is causing all these issues, they wouldn't look healthy. It's very clear when we're putting things in our body that even alcohol, like most people will wake up and they'll have a headache or they'll feel inflamed or it's because it is poison, right?
And I also like to reassure patients too that this peptide is something, the GLP is something your body already makes on its own. We're just adding more. Yeah. According to like hormone replacement therapy, it's the same concept. Yeah.
It would be awesome if we lived in an environment and had the activity level like our ancestors, where we didn't need these tools to replace what our body should be making. But that's not a reality. And so now you can either choose to stick your head in the sand and not do anything about it and just allow the environment and the culture that we live in to create this constant decline in your health.
Yeah.
Or you can say, hey, I see this. I know that because we're more sedentary, our food system is junk. It's not as nutrient dense and I'm not being as active. I actually need to do things to support my body if I want to age well and live healthy.
Yeah, because the alternative is much worse. Carrying extra body fat is linked to higher risk of cancer, cardiac events happening, stroke, diabetes, you name it. So if you think about the alternative, that's much worse than using your peptide.
100%. Okay. What 2 to 3 takeaways for listeners, and then also even maybe some tips going into the holidays? Even if, if you're just starting this journey or if you've been on this journey, what do we do? What do we do with the holidays coming up here?
I've been doing that more with my weight loss patients, actually, about coming up with tactics of, okay, how are we going to keep progressing through the holidays? I think a big thing is keeping the indulgences to that holiday day or that special party or whatever it is. That helps. So keeping it to that day, and then the next day, get back on track. I also think a lot of people will skip meals on those days and then find themselves ravenous when they get to their holiday meal, and then they're overeat. So you want to try to keep that day normal, eat your other normal meals, and then go and enjoy your holiday meal and then move on. Keeping alcohol limited can be helpful too. I mean, of course, enjoy your drink or two, but try not to overindulge in alcohol.
We as Americans are so good at that.
Yeah.
Right?
Yeah.
Just indulging in everything.
Yes.
Not just alcohol, but food and sugar, and cookies and pie and stuffing.
And then to go along with that, try to get a workout in that day, because it'll help keep your hunger cues at bay. So you're not overeating and overindulging all day long.
Love it. Okay. Anything we didn't touch on that you want our listeners to know?
I think some of our patients maybe aren't aware that they can come see us just to help with body composition changes. If you don't necessarily want to lose weight, that's fine. But if you want guidance on how to improve your body composition, we're available to help with that too.
And I think it's so cool because you really spend time dialing in on that specific person, taking into account all of the things like the activity and what fuels them. You look at all of that, which is so great. And the thing that I love, I think that sets you apart, there's some health coaches out there, nutritionists, that awesome, great. And they're really good at helping with kind of food plans and that kind of thing. But I think what's different for you is your background and your knowledge in how this looks medically and how that plays into the whole person, for sure, with their cardiac health, their heart health, their blood sugar, like all of the pieces. So it's super cool that you have that knowledge going into it and then really just individualize it for those people. Thanks for joining us, guys. And we will see you. We're actually doing another podcast with Emily, the dietitian. So Patrice will be with us for that one too.
I'm excited for it.
All right. See you next time. Thanks for listening in to the Flourishing Life podcast. You can watch this full video version of this podcast inside the Spotify app or on our YouTube channel. If you like this episode, please rate, review, and subscribe on your favorite podcast app. And be sure to share this episode with a friend and follow us on socials at Flourish Medical Wellness and on our website at flourishmedicalwellness.com. The information on this podcast is for educational purposes only and is not intended to replace medical advice or to be a substitute for professional medical diagnosis or treatment.